I'm sorry. That's so true.
Believe it or not, I've seen that happen.
I think it was a good depiction on how the day goes.
That is ultimately what brings us back to work every day. We're here today reviewing and critiquing common medical shows.
When I was a kid, I really wanted to be a doctor. And then when I was in college, my nan got sick, so we spent a lot of time in the hospital. And that's when I realized that the nurses really provide the care part of healthcare. So I became an RN, and I love it. Patients don't always appreciate us. And the pay's not great. I mean, considering the amount of work and the risks that we
I'm
take.
sorry. That's so true. You on oxygen trying to light it up.
Every now and then a moment comes along where you truly change someone's life. And that's beautiful.
That's happened in the ER. I've seen that happen. Believe it or not, I've seen that happen.
Sick people don't have time to be cordial, I guess. And stressed out family members don't have that time to be congenial to you. I think it was a good depiction on how the day goes.
Okay, so you are going to be ranking nurse, but if anything comes up that you can't handle, you can call me.
I'll be fine.
Can you also check in on Mrs. Thune?
Dude, I got this. Go watch your kids murder some ABBA songs. Go.
You're right. You're right.
It takes work to get out the door. It's not like, okay, I'm done. It's a hospital. It doesn't close. And I think that's the point that might get missed by the general public. Just because it's 5 o'clock, you just don't walk out the door. It depends upon what's going on.
Yeah, healthcare is definitely not 9 to 5. Would be nice if it were, but it's not.
Hey, Stella. You're going to twist that line. She's going to twist that line.
Just don't look away, please.
Okay. You know what? I'm just going to do it.
Can't help yourself.
Controlling? No, I haven't heard that before.
Micromanagement.
This is not the type of job, where if you mess up, it's like, oh gosh, we lost a big account. This is like, if you mess up, we took out the wrong organ, So you don't have to do things my way, but you do have to do them the right way, which is, how I do them. So.
Whisper, we might be behind the curtain. We might have some eye signals like, yeah. So we do have ways of communicating so that, we get each other's attention like we got no problem. Because again, we want patients to be comfortable and to be comforted.
She cares a lot, which is great. As nurses, we care. It's a caring profession. But you also have to be able to leave at the end of your shift and to be able to go do those things with your family.
In hours, and your computers are not my problem. Please. You're my problem. You don't listen.
Okay. I hear you. And I give you the number for the person who can help you. All right?
Mm-hmm.
That's the White House. Ask for Joe. Tell him there's a nursing shortage and we need him to fix it. Next.
I never knew I was allergic to avocados.
Yeah, they're silent killers.
Okay, I got the EpiPen.
Great. He's gonna give you the shot.
You want me to? Not a problem, because I am a nurse. So, okay. I've done a lot of these before, usually with someone supervising, but that's fine. It's just a quick stab.
Oh.
Take 2. Here we go. Just quick stab in the leg. All right, 3, 2, 1, stick. Okay. Wrong side. Got myself. That's intense, huh?
You okay?
I feel like I need to go to the hospital.
The directions are on the container. The woman was not in such a respiratory distress state that you couldn't look at it. I mean, it's by pictures and it's by words about what to do. You don't even have to use alcohol. Just jab it.
The unrealistic part of that was that after he shot himself with epinephrine, he would not be able to work for a little while because he would be so hyped up.
Those things are learning experiences. He didn't check the patient's name, date of birth. He didn't do a lot of things right. It seems like he doesn't really know what's going on too much.
Somebody's kind of left him there to learn on his own. And in that case, yes, things like that are going to happen. But that, and they made it funny. But sometimes things like that could be really serious.
So that's part of the comedic piece of it. But yes, I have seen people give shots and literally shoot themselves right in here. And we're looking at each other like, that's a nice incident report.
Gonna be tight, but I'm gonna make it. I mean, I love this job, but it is just a job. You know? You gotta have boundaries. I'm always saying that. I'm always telling my nurses that you have... Ma'am, are you sure you're okay? Oh, my God. Oh, my God. Okay. Her breathing's really shallow.
It's our IV, wide open.
Get her on the monitor right away.
Yep.
The nurse that brought the lady in would be shouting for help as she was walking into the room. They wouldn't have walked in the room and closed the door and had nobody in there to help them.
Then the woman that played it, she played it just right. She can hardly walk. She's dragging. Very common. Somebody else might say, oh, she might be on drugs or diabetes. No, she was definitely having problems walking. I thought she might have been having a stroke, but I kept remembering the leg pain. I said, she's probably got a clot.
We need some doctors in here. Call Code Blue Respiratory.
Yep.
How are we doing?
Code Blue?
Compression?
Code Blue in here.
Matt, use the intercom!
Is there a button I'm supposed to push or something? I've never used one of these before. Cavalry's on the way, guys.
Oh no.
What's going on?
Where are the doctors?
On 3, 1, 2.
Oh, I already...
Code Blue.
We've got a code blue in trauma 1A.
I think you need to press that button.
I understand.
So, where are we?
She fell and
What's
is
happening?
old.
Last in the parking lot, shallow breathing, hypoxic, 83%. We lost her pulse.
She was in the waiting room. She said her leg hurt.
Sounds like DVT turned pulmonary. Let's get some heparin in here. She sounds like a smoker. Could be pneumothorax.
It's an embolism, Bruce.
I think it's both.
Oh boy.
All right, let's get her stabilized.
So, blood clot in her leg triggered a pulmonary embolism, and that in turn caused her lung to collapse. Which is pretty rare, but it happens. Yeah. I saw a couple during COVID. We were at war. Colleagues became brothers. Okay, I think we're good here.
When they said, and more than likely is this because she's not breathing, she's not aerating as we're doing the ambu bag, that she's probably got a pulmonary embolism. We're still gonna do a lot of tests, but what we also try to teach in the graduate program is just this, that your assessment is everything. The tests confirm. So a good assessment is everything. Just because she's not bleeding and on fire, as we call it sometimes, they've got smoke coming off of them. She had just as serious a problem as somebody having a heart attack.
Okay. This is fine.
Hey.
Sir, I am not in the mood to be assaulted by a stranger right now.
They told me that you're the one that saved my Lori.
Oh, your wife. Yes.
So it makes it worth it.
Thank you. Thank you.
She definitely needed that. So first off, this show isn't nearly as medically accurate, but it does have some, parallels. In the end, those kind of moments where, a family member will come up to you and give you a hug and say, thank you for, saving my family member, those really make it worth it. And they really demonstrate the impact. So as nurses, we kind of have to hold on to those moments because when times get tough, because as you can see, that there's a lot of challenging times as a nurse, it can be very stressful. But those moments where we make an impact, you really have to hold on to those because it can really, create a more positive thought process.
There's a lot of truth to all of this. That last scene, for example, I've had people walk up to me and I'm like, I'm out, I'm done, to say thank you. And not just because they should. It is from the heart. That is what keeps you coming back.
That is ultimately what brings us back to work every day.
Sometimes that's all it takes at the end of the day to make all your sacrifice worthwhile. I've seen situations like that where I've impacted people's lives and just that thank you made it worthwhile. And that's why we do what we do.